This weekend I spent my Saturday morning doing 2 craniotomies for chronic subdural hematoma. And I was explaining to the patient and their families what this particular problem is. And so I thought it might be nice to spend a moment to explain what is a chronic subdural hematoma. When you look at the term, chronic means old, or it's been going on for a while. And then subdural, there's a covering of the brain called the dura, and the location of this problem is under the dura. So it's between the brain and the covering of the brain, but it's under the skull as well. And then hematoma means blood or blood clot. What the typical scenario is, a patient has a fall or an accident, maybe they're on a blood thinner, and they develop an acute subdural hematoma, meaning a little bit of bleeding occurs in that space. And maybe it's picked up and maybe it's not. Maybe the patient knows about it, maybe they don't. The body forms a capsule around the blood, or can form a capsule around the blood, and try to get rid of it. But maybe there's another fall, or maybe there's some swelling. A patient that's hit their head once is prone to hitting their head again. And it creates a situation where the body forms a capsule, there's maybe some dysfunction of the brain, a higher chance for trauma, maybe more bleeding, more capsule formation, or membrane formation. The membrane itself can bleed, and the membrane and capsule itself can cause swelling. And this creates a cyclical downward spiral where eventually the patients come to the hospital because they keep falling, they're having worsening headaches, and there's dysfunction of the brain in general. A CT scan is done, and the CT scan really shows you what you need to know. It shows blood in different stages of evolution. It shows the mass of the subdural hematoma itself, and it shows the brain being pushed over. Strategies for treatment. If the subdural hematoma is small, we can treat it with medicine, mostly to counteract the inflammatory response from the blood to get it to resorb on its own. Most of the time, though, surgery is required. Sometimes we can do what's called a burr hole, where you just put a hole or two in the skull and drain the fluid out. That only works if it's just fluid. If there's also a lot of membrane formation, a burr hole will not be effective. The final option is to bite the bullet, so to speak, and do a full craniotomy, where we make a big incision, open up the skull, open up the covering of the brain, and then peel these membranes away from the dura and away from the brain and remove all of it. Honestly, the chronic subdural hematomas look a little bit like a placenta, where they have fluid inside of them and they have membranes and there's an outer covering. Surgery is relatively straightforward. I think each of these craniotomies took me maybe an hour and a half to do. The patients had a drain left in place that we kept in for a couple of days, and they've both since discharged from the hospital. One of the problems with surgery for chronic subdural hematoma is that there is a relatively high rate of recurrence. Whatever caused the problem in the first place may still be there, and we don't always get all of the membranes out because it's hard to open up the skull big enough to have the ability to reach every aspect of the chronic subdural hematoma. Hopefully that's helpful. I think that the best way to prevent these is to prevent falls in the first place, especially if you're on blood thinners, which we've talked about. And then if you're noticing headaches, balance issues, frequent falls, those kinds of symptoms, definitely worth getting a scan so we know what's going on.